Hi, everyone. I am Mehek Pawa. I'm one of the PGY3s, and I'll be going over PRITE review for psychotherapy. Starting with this topic, this is one of the most frequently tested topics in PRITE, and they really love our old guys and everybody in psychology. Last year specifically, it was a very loaded topic to the extent that they asked the same question twice in a twisted way in the same booklet. So going with that, the first question for the day is, according to Margaret Miller, Developmental Theory of Psychology, which of the following indicates a successful resolution of the process of separation individuation in a toddler? And the options are trust, intimacy, object constancy, normal symbiosis, and secondary individuation. And I'll give a minute for everybody. Okay. So we did, I think majority of the people were right. The answer is object constancy. I know there was a split between the trust. So let's go over what these are. Margaret Miller was a Hungarian-American psychiatrist who worked on ego psychology, and she described a mother-infant relationship in the first 3 years of life. She basically filled the gap between psychosexual stages of Freud and Erikson psychosocial stages. She divided them into 3 stages. So the first one is the first month of life, which is the normal autistic phase, in which an infant doesn't care about who else is there and is pretty just concerned about his needs. The next 1 month to 5 months of age is the normal symbiotic phase. And in this, an infant vaguely acknowledges that the mother is there, but is still not able to differentiate mother from himself. Then comes, I'm sorry. And then comes the separation individuation stage, which is subdivided into multiples, but we get tested on the last stage. The others are differentiation, when a child starts differentiating between himself and his mother. Practicing, when they start crawling and moving away from the mother, but are still worried. Rapprochement, they are exploring the environment, like going and playing, but stay around their mother because they're worried that they'll get lost. Object constancy is something that we achieve at the end of 2 years. It's 24 to 36 months. But at the end of 2 years is when a child goes to school, and at that time, they're confident that mother is not going to disappear even if they move away. So we developed this according to this theory, object constancy. Coming to the next question. A cancer patient becomes nauseous when seeing a commercial on the TV for the local cancer center where they receive chemotherapy. The patient's nausea is best described as what element of classical conditioning? Is it reinforcement? Is it conditioned stimulus? Is it conditioned response? Or unconditioned stimulus or unconditioned response? Okay. So I think everybody's pretty much clear on this. It is conditioned response. and then I'll just go over this briefly since everybody seems to know this well. Pavlov is the one who worked on classical conditioning. For this particular question, the unconditioned stimulus was chemotherapy, and unconditioned response was nausea to chemotherapy, whereas the neutral stimulus was the hospital where the chemotherapy was done. So when they combined the hospital with the chemotherapy, the nausea became the conditioned response to the stimuli. And now when he saw that advertisement of this hospital, there was still nausea in response, which was a conditioned response. Just briefly touching on Skinner, who worked on another theory in which he described reinforcement and punishment. We either get like one of the questions, it could be classical or the operant conditioning. And on Skinner's, they will ask questions like, about the positive reinforcement, which can be in patients with schizophrenia or token economy. Sometimes they will ask you direct questions on Skinner's experiment on pigeons, where you give a reinforcement every time they have a behavior, and then how frequently you do the reinforcement. So the quicker the reinforcement is, the quicker you do it, the best it is. So there are a couple of questions on this. So I would recommend reading about this just so you're aware of the basic theory about Skinner's too. Coming to the next question, this is, which of the following attachment behaviors typically present in the first month of life? Is it the separation distress, anticipatory posturing to be picked up, smiling preferentially to caregiver's voice, imitation of caregiver's facial expressions, and babbling more with primary caregiver than with the stranger? And let me get the polls up. Okay. Okay. So this was pretty split. And the answer here is smiling preferentially to the caregiver's voice. Let's talk about Mr. John Bowlby, who described 4 phases of attachment development. The first phase is pre-attachment, which is first month or up to 6 weeks of life, in which he said that the infants form a relationship. They respond positively to the caregiver, and the infant will recognize caregiver's voice, the smell, and the face. And they may smile, they may give signals like grasping, crying, smiling, and gazing to the primary caregiver. After that, from 6 weeks to 8 months is attachment in making, and that's when infants will start babbling and smiling more, and they will become calm when they are picked up. So the one that they are raising their arms to be picked up is in this phase of attachment in making. Infants learn their actions from the behaviors of those around them, so there can be some mirroring. They develop a sense of trust, expecting a predictable response from the caregiver. So this is the second phase. Then comes the clear-cut attachment, which is 8 months to 18 months. And in this, they become upset if they experience separation from their primary caregiver. That's when the separation anxiety kicks in right at that 9 months age. And then they may show distress when the primary caregiver leaves, but the anxiety can be short-lived if the replacement caregiver is empathetic and supportive. And then after 18 months is reciprocal relationships. This is when the separation anxiety starts decreasing as language and cognitive skills start growing up. And then toddlers can understand that, the caregiver is going to come back. So they're more secure by the end of this time. So John Bowlby worked on this, and this is also sometimes tested. He gave 4 attachment styles based on his theory. So there can be a secure attachment, there can be an anxious attachment, a dismissive avoidant attachment, and then a fearful avoidant attachment. Secure is someone who has healthy boundaries, can develop mutual trust and support, and controlled conflict resolution. Whereas anxious are their fear of abandonment. So some kids will be very anxious even when they are adults. And this can stem from their, based on this theory of attachment. They need constant validation. They develop on their partner for self-worth. And then avoidant are the ones that avoid any relationships, commitments. They are more guarded and closed off. And then fearful, they have fear of rejection, hard time trusting or relying on the partner, and have low self-esteem. Coming to our next question, it's on Ainsworth introduced the strange situation experiment to evaluate which of the following: attachment between a parent and a child, concrete pre-operational thinking in a child sharing mental experience with the parent, infant's ability to use adult feedback for affect regulation, and internal representations of multiple caregiving in an infant. Let me go back. Okay. So I think we had some hesitancy in this question, and there is some split here. Okay, let's go to the answer. So the answer here is attachment between a parent and a child. Strange situation experiment was done by Mary Ainsworth. She did this in 1970s. And then she sort of studied the attachment relationship between the infant and their caregivers. So whatever John Bowlby did, she expanded on the same thing. And then in this experiment, what she did was there were like 7, 8 steps to it. In the first step, a child and a caregiver will enter a room with toys and the child is free to explore. In the second step, the stranger will enter the room and interacts with the caregiver. Then the caregiver will leave the room and the child is left alone with the stranger. And then caregiver returns to the room and the stranger leaves. And then caregiver leaves the room again and the child is left alone. After that, the stranger will come back and will comfort or engage with the child. Eventually, the caregiver returns again and the stranger leaves. And that way she studied how the child behaved when the caregiver left and was with the stranger. And she gave different options of attachment styles, whether it is secure attachment or an insecure avoidant attachment or an ambivalent attachment or a disorganized attachment. So John Bowlby gave 4 different types of attachment, and Mary Ainsworth worked on the attachment styles an individual makes with another person. So just being aware of the name of the experiment, I think is good. Just throwing in a bonus question with all these attachment theories that we did, another question that was seen multiple times. I've not put a poll for this one, but you guys can just read this. Which of the following has been found regarding infants' attachment to their parents? And this was on the basis of Ainsworth, Mary Ainsworth. So infants can form strong attachment to only one parent. The infants will attach to father only if he assumes the maternal parenting role. Infants can form multiple attachments, but the strength of those attachments may differ. Infant will attach more strongly to mother, even when the father spends more time with the child. An infant's attachment is a function only of the amount of interaction with the primary parent. So based on the last experiment, what Ainsworth was trying to show is an infant can form multiple attachments, but the strength of those may differ. So when the caregiver leaves and then there is somebody else, it can be a grandparent, it can be a nanny, it can be any other relative, it can be the father. The child will form attachments to another person. Also, the strength of that attachment will differ. Okay. Coming to the next one. A 33-year-old woman reports feeling sad and experiences symptoms of mild depression following the birth of her child. 4 months ago, she reports distress about difficulty in making the change from working professional to mother. What psychotherapy was designed to address the change? Let me pull up the question. So it's either interpersonal, psychodynamic, DBT, CBT, or motivational enhancement therapy. Okay, I'm going to end this. And it looks like we are pretty split here. As my therapy supervisor says, the name of the therapy doesn't matter, and we always do multiple therapies at once. It does matter when it comes to PRITE review. So for this question, the right answer is interpersonal therapy. And then we are looking for a few things in that. So I'll go over the different types of therapy, and then we'll talk about the interpersonal therapy. So to begin with, we have psychoanalytic therapy, which is based on Freudian tradition of uncovering the unconscious aspects of a patient's mental life. And it focuses on the unconscious conflicts, repressed feelings, family issues from early in a patient's life, and difficulty with current relationships. You need to be pretty committed for that. So like 5 to 6 times a week, or at least 3 to 4 times a week for an hour for many years together. So this is a new mother that we were talking about. And then there are different therapists that are associated with different types of therapy. So you should just know about their names. Sometimes they test that. Then comes insight-oriented therapy is a form of psychodynamic therapy, and it is like a shorter form of therapy. It occurs 3 times a week with 30 to 50 minutes, but works on the same mechanism. The brief psychotherapy is also a similar form of the therapy. And in this, you find a goal that you want to achieve. There is a specific treatment focused, and then you have limited number of sessions for this therapy. Coming to the one that we were tested on, interpersonal therapy, was developed by Clerman and utilized by Sullivan. This is a brief therapy that addresses relationships and is used to treat depression. Occurs for 12 to 16 weeks with monthly maintenance after. Most commonly treats MDD. And here what we were looking for is, it is basically for 4 types of problems. One is unresolved grief. One is social role disputes, like you have a conflict with a coworker, spouse, and then social role transitions, like demotion in a job or children moving out, or you're promoted to a new role, or like a new mother. And then the interpersonal deficits, learn to establish healthy relationships and decrease social isolation. So basically, when there are life changes or some new things in life, interpersonal therapy. Coming to supportive psychotherapy, it is usually brief with the focus on helping the patient deal with a life crisis. And it is effective for acute grief reactions, occur once a week for 30 to 50 minutes and can last for a few months. Then coming to behavioral therapy, it focuses on reducing overt behaviors that are symptoms of the mental illness, and it uses conditioning and modeling. It was developed by John Watson. The types of behavioral therapy that we have is systematic desensitization that was developed by Wolf. And in this, we slowly make a hierarchy and then expose them to the stimulus and then prevent the escape from that situation and then in a way help them deal with the anxiety. Flooding is where there's no hierarchy, there are no relaxation techniques, it is in vivo, and they are presented with um, the real stimulus rather than just imagining it. EMDR is our saccadic eye movement therapy, which is used for PTSD. So this particular word is mainly for PTSD when you're focusing on, eye movement desensitization. So the way it is done is there are multiple stimulus that a therapist uses on which you focus. For example, you're focusing on the mouse that I'm moving, and at the same time, they talk about the trigger that happened. So you are redirected somewhere else. You learn to relax while experiencing the same trauma that you had. That forms the basis of this therapy. Positive reinforcement is a token economy to reward patients for desired behavior. And then DBT, if this comes, it's mainly for people with personality disorders, mainly borderline personality. It is a combination of supportive, cognitive, and behavioral techniques. Coming to the last one, CBT, it focuses on interplay of maladaptive thoughts, feelings, behaviors that can cause mental disorders. And this occurs over 15 to 20 weeks and has a cognitive triad of negative self-perception, patient that sees the world as a negative place and expects failure and hardship. So staying on the therapy, let's see the next question we have. Which of the following forms of psychotherapy it's most likely to describe a therapeutic goal as improve ego functioning and self-esteem? Okay. Okay. I hope I did a better job at explaining this, but I think we still have some doubts here. Um, so it is supportive therapy. And in this, you're improving somebody's ego functioning and self-esteem by building them up. Interpersonal is more of like two people therapy. You need somebody else in the relationship for this to work with. You're working with, issues at work, issues with a new baby, issues with a coworker. DBT is more of with personalities, and it is not just the self-esteem. You're working on their behaviors, their impulses. And then exposure therapy is more for OCD, and family therapy is for family. Okay. So now coming to the next one, question 7. A 23-year-old patient began psychotherapy due to feelings of inadequacy and depression in the context of working in a coffee shop since graduating from college and deferring medical school acceptance. The patient has been having conflicts with parents over their ambivalence about becoming a physician. Which of the following is the most likely developmental task with which this patient is struggling? Identity, intimacy, mastery, productivity, or generativity. Okay, I'm going to end this. So the right answer is identity. I think most of us knew this, but it's still a learning. Erikson keeps haunting us in our dreams. So please remember this chart. He will be coming in one of the questions for sure. I don't know why they love him so much. But let's go through the stages. So infancy is the first year of age where you develop trust versus mistrust. And the virtue that develops is hope. And it's just on, if the basic needs of the infant was met, the nourishment and the love, then the infant learns to trust others. Coming to early childhood, which is 1 to 3 years of age, where you develop virtue as well, and it is a conflict between autonomy versus shame and doubt. This is based on that the child will learn, how to hold his bowel and bladder. And then if they're able to learn it appropriately, become independent, then they're more autonomous versus shame or doubt. Play age of 3 to 6 years is initiative versus guilt, and you learn purpose. So a child learns to take initiatives at school and, starts developing interest in some activities. Then comes the age of 7 to 11 years, which is industry versus inferiority, and the child learns competence. They develop self-confidence and abilities when competent, or the sense of inferiority when they're not. Coming to adolescence, which is 12 to 18 years, that's when the identity versus confusion develops. And the virtue is fidelity. Experiment with and develop identity and roles. So in this particular question, this stage has not been resolved. This child or this patient has identity issues, and that's why he's not able to move on to the next stage of early adulthood, which is 19 to 29, which is intimacy versus isolation. And you develop love as the virtue. You establish intimacy and relationship with other people. If you're not able to, then there is like isolation. Next stage of life is 30 to 64 years, where it is generativity versus stagnation, and you develop care. You contribute to society and be a part of the family. So if you're not contributing to the society, not doing well in your career, it's more of stagnation. Whereas if you're more active, it's more generativity. And then at 65 onwards, it's integrity versus despair, and you develop wisdom. Looking back, if your life makes sense and you're contributing still. Okay, so just remember this is a very important chart. Coming to the next question. Which of the following developmental stage is associated with emergence of symbolic play? So this question was tested twice last year on the same booklet. We have options as sensory motor, pre-operational, formal operations, and concrete operations. Okay. Okay. Now the right answer for this question is pre-operational. 50% of us got this right. Sorry. And let's talk about where this is coming from. So this is based on Piaget, stages of cognitive development. This is another chart. You guys should just learn it as much as you can. They'll definitely ask you a question or two on this. So the first stage is sensory motor. It is in the first 2 years of life. And that is when you're coordinating with your senses, you're learning to walk, you're learning with your sensory curiosities around the world, you're using language. And at the end of this stage, you develop object permanence. The same thing that, Bowlby and Ainsworth, they all said that the child just understands that even if, mom goes away, she still exists. And Piaget worked on it with peekaboo theory to develop object permanence. Then comes the pre-operational stage, which is 2 to 7 years old. So remember, symbolic thinking is when the kids are like 2 years and they start playing, okay, I'm the mommy, I'm the doctor. So they are doing symbolic play. They start using syntax and grammar to express concepts. They are imagining a lot. Their intuitions are strong, but the abstracts are still difficult. Conservation is developed. So when a child is 5 or 6, they understand if you pour water, 1 bowl of water in 3 cups, the water amount is still the same. Coming to the next phase, which is concrete operational, this is 7 to 11 years. In this, a child is learning about, the space, the weather, the temperature, and all the concepts that science, social science, and the world wars. But they have, these are the concrete thinking or the operational thinking that is being provided to them, but they do not have abstract thinking. That comes in the stage of formal operations, which is 11 years and older. That is when they start having the abstract thinking and reasoning, something that we check on MOCA also, the difference, the similarities between a clock and a ruler, or things like that. So a child will develop it after 11 years of age. So remember this. Coming to our next question. A patient is on long-term psychodynamic psychotherapy, verbally attacks the therapist for being controlling and uncaring. This patient's behavior is most likely an example of which of the following? And let me pull this question up. I put this question. I'm not able to launch this. Okay. Okay, I'm sorry, I'm not able to launch this. It says it has been launched. Maybe I did something. But anyways, let's go with the question. Anybody has any thoughts, wants to unmute and tell me the answer? Okay, the answer for this one is transference. And I put this question in, specifically because we can get mixed up with splitting. And that is because of the keyword that they put in here was the long-term psychodynamic psychotherapy. And they want us to be aware about the transference that particularly occurs in psychodynamic and psychoanalytic psychotherapy. And this is a technical term used to describe an unconscious transferring of experience from one interpersonal situation to another. According to psychoanalytic theory, transference evolves from unresolved or unsatisfactory childhood experiences in relationship with parents or other important figures. Whereas splitting will be, it is all gray and white. It is it is in people with borderline personalities, and then this is good, this is bad, he's good, he's bad, and others are defense mechanisms. So now coming to the end of this, the last one is on defense mechanisms. And I think I won't be able to pull up the poll again because I closed it and now it's not letting me launch the question. Okay, anyways, let's just talk about the answer here. So a patient discloses that they are experiencing distress during a breakup and have been pouring their energy into a kickboxing class at their gym. This is an example of which of the following: repression, sublimation, separation, displacement, or reaction formation. And the right answer here is sublimation. Going through these defenses. So sublimation is when you put your energy into something else which is useful. So this person poured his energy into a kickboxing class, whereas displacement is when you're displacing your anger from one to another. The boss scolds the person under him, he scolds his child goes and kicks the football. So that's displacement. Whereas sublimation is putting it in for a useful thing. And then I tried putting in the defense mechanisms in a chart, but we do get 1 to 2 questions on them. So just knowing that the different types of defense mechanisms and will be tested on at least one of those. Okay, I think I won't go through this. It's a pretty big list, but yeah, I mean, I would encourage everybody to read this. So I think I'm at the end of my talk. Thank you, everybody. And I think I'm going to end it.